afternoon. Can I just say welcome back? I realise that there will be people coming in, there will be people leaving. This is the end of the day, so we realise that that needs to happen. Welcome to the last plenary session for the Health in All Policies conference, and we hope that you bring with you valuable learning from the workshops that you've just attended. The final session of the conference brings you 3 plenary sessions, presentations from subject experts. First presentation is from John Siddle, who is Director of Funding at Guy's and St Thomas's Charity, and he'll be addressing tackling health challenges affecting people in urban, diverse and deprived areas. The second presentation is Robin, who's sitting on the end for a very specific reason. He has to leave at 4:30, so if you see him sneak off, we will aim to end at 4:30, but if you see him sneak off, that's the reason. Robin Ireland is Director of Research at the Health Inequalities Group, and Robin addresses the local authority declaration on healthy weight, and he's sharing learning. The third presentation is from James Williams, and James is Director of Public Health at Medway and addresses place-based public health in the 21st century, everything that we are addressing today. But before we hear from John, Robin and James, I'd like to take just a few moments to share with you some of the work that the Faculty of Public Health has been doing around health in all policies. I am Sue Lloyd, and I am very pleased to be representing the faculty here today as the executive lead for policy. So, before I came here today, I spoke to John Middleton. Professor John Middleton is our president at the faculty, and he directed me towards 2 pieces of work which are related to health in all policies and the faculty. The first piece was his piece of work in the BMJ, and the second piece of work was a piece of work around influencing post-Brexit legislation, do no harm. John's contribution to the BMJ reads, improving the health of people in the UK will improve the productivity of our nation, and enhancing our health and healthcare industries will provide a platform for creating health-related jobs. This is called the health dividend, and John was writing just before the general election in 2017. The next UK government must therefore needs to make health central to all its policies, and it must not surrender our rights to health in the post-Brexit era. We will see what happens, but I think the faculty's position is clear. In terms of health in all policies, John goes on to emphasise in the article the importance of recognising the opportunities of getting health into all policies, including education, including environment, economy, licensing, leisure, town planning, and we've seen all of that here today, so it's a fantastic forum for sharing. And just to say that the faculty hasn't been idle either. The campaign I mentioned earlier, Do No Harm, we brought together 63 health organisations and called on the government to make a very clear duty from the EU to do no harm. There is a current EU article which is very clear about the definition of do no harm in the regulations. This is Article 168, and the text of that article is here. Clearly, as we move into the post-Brexit era, there's no guarantee that this will transfer into domestic law. So, based on this article, on the 18th of April, the then Secretary of State, Jeremy Hunt, guaranteed inclusion of Article 168 into domestic law. Following this, the faculty were able to galvanise partners and gain support from peers across the political divide and an assurance from government to move Article 168 from European regulation into domestic law. It's absolutely clear that health in all policies is gaining traction at all levels, from national level down to local level and to integrated systems. And we will hear more about this from our speakers.